First of all, thank you for being a valued Total EHR client. By now you've received your first EHR incentive payment and are probably thinking about what's next. Well, for many of you, that would be working towards the next stage of incentive payments to collect the remaining $42,500 and staying in compliance with the many Medicaid and HIPAA rules recently released. The good news is that there's still money out there, but you have to hurry. Year 2 requires you to track your processes for 90 days. This means that your staff has to be trained and ready by September 28th of this year at the latest. For those of you who've already received Year 1 incentive payments, you can start on Year 2 incentives worth $8,500 for each provider. If you've hired anyone new in your practice this year, they may be eligible for $21,250 for Year 1 incentive benefit money. Much has changed since we first began working together. The states have gotten much more demanding in regards to the manner in which reports are run and the specific paperwork used to format the items for submission. But don't you worry. We've successfully submitted over 5,000 providers and have the process down to a science, making it an easy, step-by-step process just for you. Let me give you a little overview of Year 2 and what you can expect. Our account management team will help identify if your practice qualifies for Year 2 incentives based on your Medicaid percentage and your software eligibility. We will provide a high-level overview to your entire staff and decide each role that each staff member will play in this process. We'll do a deep dive to determine any changes that might need to be made to your standard operating practices and limit those as much as possible. We'll work with you to establish a process to collect the required information from your software. We'll also file all of your paperwork and help push it through to the system at each state until you're paid. The government has made it clear that the guidelines for dentists are becoming more and more stringent and that protecting the patients with an electronic health record system is becoming commonplace. Many states have already passed laws mandating EHRs in all medical and dental practices. This leads me to the benefits of our offering. Your practice will benefit from being compliant and being in compliance with all meaningful use rules from Medicare and Medicaid. Your software will be upgraded to the latest and most advanced version meeting ONC's governmental standards. Because of your compliance with the new meaningful use rules, you will be on your way to complying with the new HIPAA laws as well. In many instances, applying meaningful use standards will help streamline your office procedures. Meaningful use also helps create a safer environment for your patients' information and improve the quality of care you are able to provide. Our service works best with the 2014 certified version of Total Dental. While some of you may be familiar with Total Dental, others may not. But it was created just for you. The big guys have fallen behind in offering solutions that meet the government's new criteria, and very few of the traditional systems qualify for the ONC 2014 certification, allowing you to receive Medicaid's EHR incentives. We saw this early on and have created a solution to help you qualify for the stimulus program. We have found that Total Dental is the easiest to use and most advanced dental practice management EHR system available today. I'd also like to thank all of you who have sent us questions and comments and suggestions about what you would like to learn about Year 2 of the Medicaid EHR incentive program. You've spoken and we've listened. From your comments, it's clear that the dental market has been underserved and that dentists everywhere are taking notice and demanding more. In listening to your comments, 2 questions have repeatedly come up about the program. What are the goals and benefits of meaningful use? By successfully demonstrating meaningful use, providers will improve quality, safety, and efficiency of care, engage patients and family, improve care coordination, improve population and public health, maintain privacy and security of patient health information, and you'll be in compliance with CMS guidelines and avoid any potential payment penalties or audits induced by Year 2 non-participation. The second big question was, is Year 2 that much different than Year 1? Yes, is the answer to that question. The biggest difference is that in Year 1, most of you adopted a certified EHR, but for Year 2, you actually need to demonstrate implementation and use of a certified EHR in your dental practice. For 2014, you need to use the system for 90 days at a minimum. We've covered a lot of ground and are excited about learning more about you and your needs. As we lead up to our launch in September, I'll be sending more details about the event in the next few days. We are going to be offering a very special deal for a limited number of Total EHR clients. There's going to be some really cool stuff that I'll be sharing with you in the next video, so watch for it in your email. If you haven't done so already, make sure you sign up for a live demonstration of our complete Year 2 walkthrough. Also remember to post your questions, comments, and suggestions to our blog. You'll find the links below.